Welcome to another episode of Mind Your Mouth podcast. I am your host, Melissa Mugno, and I am so excited for today's episode. We are going to be having another amazing conversation with a colleague, a friend, and somebody who is just kind of crushing it in the airway space as well on social media for education. So without further ado, I am excited to introduce Dr. Erick. Hi, Dr. Erick. Welcome to the pod.
Hey, how's it going, Melissa? Thank you for inviting me. Excited also to be thankful for the invitation and ready to go to have an exciting and like down the rabbit hole conversation. Yeah.
Absolutely. That's always what we're trying to do. I always tell everybody that anytime I bring somebody onto the podcast, it's kind of the quote is, you probably have seen this person somewhere else, but hopefully you get to see a different side of them on Mind Your Mouth, and something that, you know, we get to talk about all the things that we're passionate about, but also what makes us really unique. So, Dr. Erick, for some of the people that don't know who you are, where you come from, why you're so cool, why I wanted to talk to you, tell us a little bit about what you are professionally, but also personally.
So hi again. I am Dr. Erick Galindo. I'm a pediatrician from Guadalajara, Mexico. That's a big city metro area in my country. I've been a pediatrician professionally for over 19 years, graduated 2007. I'm a husband, I'm a parent. I have two amazing teenage kids. I have speaking about breathing, I have two brachiocephalic bulldogs, English bulldogs. So I have two snorers.
Okay, so you know about breathing when it comes to bulldogs.
Exactly. So, we just love them in the family, and we always make analogies with them. I've posted with them about Airway on my social media. And I'm a people's person, especially with people internationally. I don't know why. I love to connect internationally with colleagues from different fields. And here I am.
I love that you said that about the international stuff. I have found the coolest thing about this Airway movement has been the international connections, right? Like for me, it made the world, I don't want to say small, but so much more tangible, right? Like I feel like there's not a country in this world I probably couldn't pick up the phone and call somebody.
Exactly.
And maybe have dinner and talk about, I don't know, have some common ground. And I think that's such power to make things more like connective and just make the world more of like more accessible. I don't know. That's how I look at it, right? I mean, I feel like you can go anywhere now and have a conversation with somebody.
Yes, exactly. And it's the growth and the connections have been to me exponential. And then, you mentioned a movement. Yeah, this is a movement. I mean, it's something that it connects us to everyone. I mean, breathing is everything. It's a beginning, as one of my mentors says, and it's professionally and beyond professionally, like people that want to get better. I mean, in any field of life, as a human being, it starts with consciousness of breathing. The breath of life. Yeah, exactly. Mm-hmm.
You know, I think that's an amazing place to start because it's a very simple concept.
Exactly.
Breathing. Most of us take it, I would say, for granted. Mm-hmm. We think if we're walking around the planet, we're breathing well. Mm-hmm. But, you know, I think I would love to dive in and ask you a little bit. So pediatricians, when I think of a pediatrician, I think of mine growing up. Mm-hmm. I remember him. His name was Dr. Edwards. He was this I'm an 80s baby. And I remember we were there a lot. My mom took me to the pediatrician. I feel like I remember when he told me I was like 18 and he's like, or maybe 16. And he said I needed to go see a woman doctor and go do some other things. It was sad because there was no lollipops and, you know, all the things I got really used to. But, you know, I think back to my time, my mom brought me to Dr. Edwards and I remember I was on a lot of antibiotics. I remember I would go there was a lot of I feel like I drank the pink bubble gum moxicillin my whole growing up a lot. But I also remember my mom and him having I feel like my mom trusted him a lot, right? Like, you know, he would go, I remember exactly where his office was, but I don't have that same relationship with my pediatrician for my children. I did with my daughter. I had this really great with Natalie. She's 15, going to be 16. We had this really great doctor in New Jersey who was an Asian guy, Dr. Ching, and he was doing medicine differently, but that was small and few between. And I will say most of the people following this podcast, Dr. Erick, their pediatricians are not, they kind of fight us on this movement. I don't want to say fight because I don't think pediatricians fight. I think they just dismiss or they don't take it too seriously. I find most pediatricians to be pretty kind, but they pick their battles. They don't say things. Can we talk a little bit about that? Like what went from pediatricians in the 80s to now, and what's the stance on breathing? And, tell us a little bit how you are, where you are today.
Yeah, I think the movement found me. Airway, I didn't find it. It found me. I have so many stories, so many ways I can keep the conversation going regarding your thoughts. My dad is a pediatrician. I'm 48 years old. He's been a pediatrician for my age. And I still remember some things. I worked with him after graduation, 2007. I remember how we, especially with, for example, kids with enlarged tonsils and adenoids, we focused on I still remember, you will grow them out. Just, we were against surgery and we thought of ourselves like conservative, pro parents. It was no, don't go into adenoid surgery or tonsillectomy. You will grow it out. Your face will grow the size of the tonsils and then you'll have space again. And completely oblivious of the consequences on breathing, on sleep. And being a pediatrician was being busy, the healthy checkups the first year of life. And then starting 1 year, it was treating illness, the Band-Aid effect. I still have some phrases how kids are boogery. They always are boogery. That's in Spanish, we have a say they always have boogers. That's why they call them the boogery kids. So, and nothing concerning proper breathing through the nose. It doesn't matter. It was more, without any awareness of the importance of breathing, of posture. So it's a pediatrician was about getting busy with illnesses and treating illnesses and prescribing antibiotics and just getting solutions for the acute things, and the follow up was growth physically, percentiles, growth charts, vaccinations, introduction to solids was about content, nothing to do about how you swallow, how you chew, how you need to coordinate, how you breathe. It was and even my dad, last thought, it was I remember I wanted to have my teeth aligned. I knew there was something in my mouth and he even showed me to his patients and look at your teeth are fine. And I have the worst crossbite and I'm a snorer and I know I already have a TMJ problems. So he was you're fine. And when should I go to the dentist? No, until you have full teeth erupted.
Until you have your full adult dentition and all that kind of stuff, right?
Yeah, there was.
So really, as a pediatrician, the teeth were not something you guys were even. Unless it was a very severe situation, right?
Beyond being able to notice any cavities or forget about dental wear, the importance of nothing. It was. At this point, it's funny, but I think. This is a cliche of being red-pilled. Once you see things, you cannot unsee them. And it's you get to a point where you see, and I think it's one lecture, one webinar, someone that's already in the movement. And then there's no turning back.
The light bulb goes off.
Exactly. Yeah.
Is your father still with us?
Yeah. He's 70. He's in his mid 70s. He still practices. He has a big practice but the concept of his practice has nothing to do with what I'm doing nowadays with,
Do you and him chat at all? Does he?
No, not at all. We once in a while a message here and there, but.
So you two obviously are practicing completely different.
Yes. It was hard.
A completely different way.
Yeah.
But I feel like your father is like a lot of pediatricians, right? And I don't mean that way. And it's because it's not broke, don't fix. Right? It's working, or no one is telling them that they're wrong. And again, I don't mean to say anyone's wrong. It's just the view, the lens is different, and it does require kind of a want or a need to want to see things from a different lens.
Yes.
And I do say, I don't think you're not going to change some old dogs, right? Like it might not be good. I always talk about legacy, and that I feel like when somebody's been practicing for 50 years, 60 years, and you try to get them to change their philosophy to this level, you'd almost be asking them to, in a way, go back and say everything they were doing before was not right, or that they were missing something. And that can really mess with someone's legacy or their purpose and this bigger driving force.
Exactly.
So I'm always very aware that I understand that's not easy for people to do.
Yes. I think the other way that you can change about your views is like, making mistakes. To me, it was like mistakes are thinking about tongue ties as something you just needed to be very efficient on using just the scissors and doing the release, and your job was done, right? I mean, and then finding I didn't get it right. I was not understanding what I was doing. Like this humbleness of knowing that patients, you're not solving the problem. I mean, the reflux is not going away. Breastfeeding was not able to keep going. And I think also the way parents are informed nowadays, I think the more knowledgeable, even if it's two sides of the same coin, it's easier for them to know things, even if it's like again, the cliched word of misinformation.
Yeah, they have more access to information, right? I mean, now, which interesting, I was going to bring it up anyway. You've created quite the social media following. And was that something intentional, or did that kind of happen organic?
It was unintentional. It was real quick. When like patient passed through my office, as nowadays, a confession, I do not have business cards. I don't have business cards at all, physically. And so one patient, like one potential patient went by, and I'm in a medical office. So it was like, I was at the same floor with many pediatricians. So it passed by my office and then stopped by and asked for a business card. And one of my assistants from before, she said like, it's going to be 4 years ago. And she goes, there's this Instagram where you can now it's like the way people find you on just like your yellow pages of nowadays of the present moment. I was like, oh yeah, it's just, what's that about? And I started posting some pictures, and then it was only stories and, hi, welcome to our business, and a picture, and we're here, and that was it. And then she helped me set it up. And then it was like, what is this thing about Reels? And it was like, I thought Erick was Reels. It's like a video, a short clip where you can record yourself and then you can edit it a little bit and you put some GIFs, and it's like, well, let's do one about like, and I remember the first one was like plagiocephaly or something like that, before understanding the ramifications of plagiocephaly. And then all of a sudden I was like, without any strategy or anything, then like the algorithm put me out there, and it was like 5,000 followers per day. And then like in 1 year, it was 1 year, and I celebrated that. No, it was less than a year. It was months, and I already had 100,000 followers, like, less than a year. So before moving offices.
Yeah, because right now you're at, how many followers do you have right now?
It's almost 190,000. Yeah.
That's crazy. I mean, there's a lot of, and it's interesting because a lot of people say, oh, like Instagram or social media, but this is where people get their information. This is where people go. You don't have to like it. It just is what it is.
It is what it is.
Not,
yeah.
Yeah, it's part of the business. If you want people to understand what your business is about, I tell everybody, you used to spend money in putting billboards, ads on the billboards. You would put your face on a bus. You would do, put yourself on a bench in the park or whatever, right? I mean,
exactly.
We always did. You'd make funny commercials.
Exactly.
Right. I don't know. You would do something to get your name out there.
I mean, nobody taught me to do this. And it was like, organically. And it, like putting myself out there the way I am. I mean, now it's my main source of referrals from first time visitors or patients or potential clients is through social media. And like the comments is like, we saw one of your videos, and it was like so authentic. It was like just so you. It was not edited, like kind of raw, like and spontaneous. And that's the way, like, I just come up with an idea and I tell my assistant, like, please record this. Let's see what happens. And sometimes and it's a hit and miss, and that's the way it has grown. And that's the way I connected with you guys. So to me, as like professionally and I don't know, personally as well, has been a blessing. I know it's
social media has made, everything has pros and cons. And social media has created access to information. Whatever you choose to do with the information, that's your human, you have to make that decision, but you have the ability to have access. And I do think, even right now, I was always kind of afraid of social media because I think if you're a little insecure, you get nervous, it can be really overwhelming. But right now, the coolest thing to do is just be vulnerable and authentic, right? Just to be your natural self. And I said it's a good time to be me because I definitely can do that better than I know how to just be authentic. So it's important to just do that. And I think that's when people struggle with social media. It's because that's what that issue is coming into that. So one of the things with the social media, you've been educating on all different types of topics. That's what I love about your page. So you don't just talk about Airway. I mean, a lot of it was just regular medical stuff.
Initially,
initially that it was just that. So I feel like parents are going to your page for all kinds of information, right? Like connecting different dots, and then they're being led into this Airway movement. You have created a TOTs center, right? Like a tethered oral tissue center.
Yes, kind of informally, but yes. I mean, nowadays it's my main day-to-day consultations are TOTs, oral restrictions, for infants, and then the second is breathing. Nowadays I don't see a lot of illness, like acute illness consultations. I mean, usually my consultations are long format, so like an hour and a half at least of a consultation.
Wow.
Yes, so it takes time for me to see a patient. I go, for example, I get an evaluation, a referral for a tongue tie, right? And I sit with parents. They're hesitant. They don't know me. They think they're going to come to me and I'm just going to say, go to the next room right away. We're going to do the release. And that's not the way I work. I mean, I have a conversation with them. I ask them about pregnancy, like where they come from. I try to build a connection, rapport, and try to reduce the fear of, I mean, nobody wakes up in the morning asking for surgery for their babies, right? So I go deep, even if I'm the one that's going to do the release, even if I'm not a breastfeeding consultant, I'm not a therapist, either orofacial or like physical therapist or chiropractor. I am not, but I'm happy that I understand concepts that you as a specialist know deeper, and I help parents reinforce the connections. So to me, it's about creating confidence. I always repeat this phrase. It's like what I'm explaining. I tell parents, does this make sense to you? And then if I get a yes, it's easy to ask if something makes sense to you because you see their faces. And if they don't get it, what's beyond a tongue tie or a lip tie or the kid having a reflux. And until I get to that point, that's where I'm happy. Even if I don't get to see them for a release, I don't mind as long as they're confident of what I'm explaining.
What you're explaining, making sure they have a good depth of understanding of what that information is.
Exactly. So creating as a pediatrician, trying to create the connection, and then sending them to the other specialists. Yeah.
So I have a couple pediatricians here that, especially one who very much kind of went down the rabbit hole. Like she started to be interested. She's part of a larger practice, I know, and most of her other colleagues are not really into it. And she's come to me about some genuine concerns of she's not sure that the tongue tie release makes as much of a difference. She's like, I think it makes a difference. I'm not sure. These parents are struggling with maybe, failure to thrive or, there's whatever their may issue is. I mean, right, from a pediatrician, we could probably go down some different rabbit holes. If you could have a conversation with another pediatrician that says, come on, is this tongue tie thing really going to move the needle? what do you say to that? Like, what's that conversation you have?
Well, it's hard because I thought it was and sometimes I have my doubts, because when you do a procedure, it's something you cannot take away, you cannot erase, you cannot go back. There's a point of no return. So I'm very self-conscious about deciding the moment to proceed and do a release. I mean, I know it's a topic that we need to read a lot. We need to know a lot about the wholeness of life, even if it sounds philosophical. I mean, as Dr. Gehary was saying, this is not a black or white thing, deciding to do a procedure. It's a team sport, I mean, even if it takes time, if you're not willing to understand what's beyond the depth of this, I mean, yeah, you're not going to be convinced, because it's not as treating a fever. It's not as circumcising a patient. So I would say, if you don't want to go into navigating the gray area, into the nuance, into understanding that it goes beyond the baby, it goes beyond the mom. It involves a lot of psychology, emotions, where you come from. So yeah, I am convinced that, I mean, it's an option to do a release. Sometimes, to be honest, I do mention that it's like a procedure of last resort, let's try to do something, that it's, I mean, we could manage, not that invasive. You're not creating a scar. So that's how thoughtful I am, Melissa, to do a procedure, even if it takes a little bit more time. Sometimes, yeah.
Well, because, so I'm always I always try to put myself, I have these two unique hats, right? I am a therapist, and so I have a clinician hat.
Yeah.
But my real passion is the consulting side. And a lot of people ask why. And because I believe really passionately in this movement, and I've realized that the only way to help this continue to grow is to help doctors have great practices so that they can build the area that parents can go to in their local community. Okay. And I only bring this up with you because I'm just curious just to have a conversation on it, is that I know a lot of docs that have taken a lot of CE credits. They go and they take a ton of CE courses, and then they go back to their practice. And just what we just said, it's not easy. It's not black or white. It's not I'm going to do this and automatically this is going to happen.
Exactly.
It requires human behavior. It's trust, it's education. And it requires, like you said, a team sport. And if you're the doctor, the team that needs to be behind you has to be your staff, has to be your you have to create your team. And I think this is an area that a lot of doctors struggle with. I think they struggle with implementation, and it becomes like a tug of war, right? And because they're scared of, let's take an answer, your father, right? You're another doctor saying to you, you know what, Eric, I think this is BS. I think you're cutting tongues and there's no science behind it.
There's no evidence.
Prove to me it works.
Yeah.
And I have sat in many of conversations and they're like, prove it to me. And I don't know, there's this movie, I don't know why I'm going there. You never seen the movie Goodfellas? I don't know. There's this thing, and it's like he does this thing and he goes, dance, spider, dance, right? And he's, doing this. And I feel like a lot of times I've been asked, prove it to me. It's like, dance, show me the dog and pony show. And I feel like a lot of people get stuck in that position. Like they don't know how to prove it because of what you just said. Is that something, can you
elaborate?
When I say that, yeah, right? Isn't that, I feel like that's one of our biggest battles that we have is to prove this.
I'll tell you something. I mean, we had a big conference. You and I were together. You were at the brown table at Tongue Time in Switzerland. And a lot of our colleagues came back with more questions than answers. I mean, it was going to be like the tongue tie conference of the year, right? It was all the big shots were going to be there. They were going to tell us this is the way. And I came back. I mean, you were at the round table. I mean, you had the most, experienced physicians from all over the world, and they were not able to.
No one could agree.
Exactly. Remember the release from even at the last day, I was at the speaker's lounge, and there was this pediatrician from Germany, from Austria. And she said, it's fine. She had a conversation with Dr. Baxter, and they were going to go back to the practices. Baxter was going to be Baxter with his laser and his practice the way he is. And she was going to go back and say, yeah, whatever you say, this is about, I'm going to keep doing my releases with scissors, because you need to understand what's beyond it. We're talking about something more. It's about the human life, and it's philosophical. I think we're starting to understand so many things beyond
just, I think, just beyond, excuse. I think this is such a great conversation. So somebody did ask me the other day, or I was doing a podcast, and they said, well, do you think the tongue tie matters? I said, no, actually, if you look at any of my newest content, me and Sarah are doing a new course. I actually say it has nothing to do about the tongue anymore, right? The tongue is one part. It's part of a bigger problem. What I think the airway movement, or whatever you want to call this, tethered oral tissues, whatever, I think it's created an opportunity and a situation for us to connect with humans again, to look beyond the symptoms, to actually have a conversation that says, you know what, Mom, you're right. I'm so sorry you're struggling like this. There's got to be something off. Let's roll up our sleeves. Let me spend an hour with you, get to know you a little bit, dive in, and I'll show you all the things I have in my toolbox. I can't guarantee this is going to be the smoking gun, but it might help us get closer to figuring out why this is so stressful for you and your baby, or for you, right? And I think it's the art of having conversations with parents again. And I would say, and I don't mean to be pulling your father into this, but like pediatricians, like Dr. Edwards or your father, I think we unfortunately got into a position where we did become a number. It became a very patternized way of treating. And if you didn't fit into one of the buckets, then it kind of like sucked to be you. Like, you know what I mean? It was just like, we were willing to forego that percentage, or some people struggle more than others because it made for better systems. It made for easier treatment or something along those lines. And I feel like the airway movement forces us to get a little uncomfortable and think outside the box.
Yeah, it's not criticism. It's
criticism.
It's evolution, It's evolution about like how we, with the role of healthcare professionals, physicians. We as physicians, for example, we always kind of look down on other fields. And to me, I cannot think of myself, or my practice, without considering other fields. And most of the fields are, air quotes, non-traditional. It's like I'm thinking about Chinese medicine, acupuncture, massage therapy. Taking care of it's a way of life. And because of the way the world is right now, you become more thoughtful, even if you're trying to push against the current, the way the river flows, and you're like upstream, you're like moving upstream and taking your time to understand and connect. So yeah, my practice has I could be labeled as the here in my town, they come to me for the tongue tie consultation, and then I see the babies.
But it opens up the door for everything else.
It's a good North Star. I do agree with you that it's not about the tongue anymore, but to me, the start at the tip of the nose, the tip of the tongue, and then it's like the entry point, it's it helped me focus of where should I start? It takes me downstream all the way to the toes, and then it's connected to the nervous system. And then to me, the mouth is also connection to the digestive system. And then digestive system is always being mindful of the immune system. Now, I think as a pediatrician, I can tell you that we used to be like very enamored or focused on finish your pediatric residency and then subspecialize. And so many years, it was like everything had to be fragmented, subspecialty. You had a chest pain, go to the cardiologist. You had some gastric pain, some heartburn, go to the GI specialist. And nowadays, I mean, we are like with this fancy names of psycho, immuno, neuro, and endocrinology. And it's like, yeah, it's a whole body. I mean, even if you want to consider it like you want to have a fancy name and get a certification in that field, I mean, it's considering your body as a whole, as it should have been before, you know? And if that's the way I'm seeing you connect with the healers, you talk about your experience, like you're healing your body, your mind, and finding the experiences you, Melissa, have had over your life to make a real change of who you are or why you're here. I like our friend Neil. I like his phrase of like being the uteronaut, you know, like being this astronaut in the space of the uterus, and you're also like we are like inhabitants of the universe. I go all the way to that place, you know, like how we're here, you know, like
how are we here and all that.
Am I losing you? You know, it's like it gets like
no, you're not losing me at all. Yeah. So, you know, I get asked a lot. So I'm not a doctor. So why, you know, what's my place in this world or whatever? And I said, I took me a long time to really figure out who I was and what my place is in this. But I think I desire, or I have the ability, like I'm a good bridge for communication and support. But because I think balance, I don't know, balance is a word that I like, it's everywhere. It's all around me because I did not live in balance, and my body was always showcasing that. I was extreme emotions, extreme fear, extreme anxiety, or extreme happiness. And then people might, you know, diagnose us with other things. But what I really recognized through my journeys was that I lacked balance. I lacked some discipline. Some people have more balance and discipline than others. But when I look at kiddos and I look at moms, especially when you first give birth to a baby, your life is not balanced, right? Things are off. Yeah. So in that moment, things are really heightened, right? And there's an interesting thing for me when I look at the tongue and I look at somebody using it, I just look whether or not it's balanced. Can they balance their tongue? Can they create balance within their mouth? If they cannot, if everything looks a little off, favoring more than one side than the other, the body's just showing you a very simple concept of that this child's not balanced, mom might not be balanced, dad's not balanced. And therefore, if you do not help redirect or distribute the weight differently, it will stay unbalanced, and then you will create, you know, more imbalances and so forth and so on. And it's a very simple concept, but that's really what I try to live and practice by now. I don't know what your thoughts are, because that's how I look at the time. I'm always just trying to create balance in the body.
I would like, I segue your concept with my concept of when I sit with parents, and I am more mindful of the feeling of the environment. I'm very convinced that we are systems interconnected. I mean, we are energy, even if it's like a Dr. Erick, yeah, but then how conscious are we about the way we connect through energy? There's energy in the air. There's the way we are systems interconnected. And I think it makes sense to me if you mentioned balance and you said, well, if you're out of balance, then you're not like just yourself out of balance. You're influencing the people you're surrounded by. So balance and the interconnectedness and that balance, especially when you are that vulnerable as a newborn, as an infant, who helps you regulate yourself? Who helps you get to that balance? And it's your circle of like of life.
Sure. Yeah. Your family.
Your family. So, and it's that, I mean, it's that self-evident human connection that we need, and how we can get the benefit of being mindful of that. So to me, that's two powerful concepts: balance and systems, connected, you know?
Well, energy, I mean, I could talk about energy every day, all day. We have a little, you know, in our household, in the morning with my kids, we always ask how are you vibing? That's like, we don't ask how you're doing. It's always just how you're vibing.
Nice.
And I always say, you know, my little guy today, he says, it's always 0 out of 10 usually. And he'll say, today I'm a 9.5. And I said, well, why? And he said, I feel like my energy is a little off the tide. I didn't sleep great. And I get people ask, well, why do you do that with your kids? I said, I want my children to recognize that it's just energy. Where their mind flows, you know, their energy goes. And I want them to recognize that they have the ability to change and move things, and that they can always raise their vibration. And if they raise their vibration, they have power, right? And we are these crazy creatures. We're in these amazing little monkey suits, and whatever you feel comfortable with of how we were formed or why we're here, there's something bigger than us. And as long as we're playing a part, and we're contributing with a positivity and giving back and looking at a whole system, anything's possible. And this journey of me connecting Airway and my teeth in my mouth unlocked that concept for me, because I, as a child, was brought up in a world, or in a situation where I was raised to think everything was happening to me, that I had no control. This is just the way it goes. Some people have better luck than others, you know, and I never was really I wasn't taught that I actually have a lot of power. Like, this world is really what I want to create it. And learning the ability of breath, and learning how to even just control a very simple thing or I shouldn't say control, just acknowledge how air comes in and out of my own body, was the first step of taking back and understanding my power. And I just don't think, as medical professionals, we spend enough time talking about that one concept: how we breathe, how we show up. And when a baby's body is struggling to do that very simple, or having to work harder, from a pediatrician standpoint, doesn't that affect the whole system?
Yes. Sometimes I think I'm mindful of not knowing or considering that I've gotten to a point that I know everything. But I mean, it has become so easy to me to start with the breath, and understanding how many things in my pediatric care could be off balance because of breathing. I know it could be a long shot, but at the same time, it could be so simple as, what if, eventually, yes, you may have to go to the neurologist, but I usually tell my patients, any subspecialty that you go to with your child or yourself, nobody's going to fight me if I help them out with helping you reestablish or establish a proper breathing pattern. I mean, everyone's going to be benefited from, going to get a benefit from this. So yeah, it's so simple. And it makes me wonder, what if the body is asking to go back to these basic concept of awareness with breathing. And I always tell patients, one of my phrases is your baby could stay without any milk for hours, but without oxygen, it cannot be even seconds to start struggling, So, and I think it's a matter of taking the time. You mentioned time, and our interactions are so ephemeral, so fast, so anxious, so get to the point that we don't get the time to say let's just acknowledge our presence and see what's going on, feel what this feels like, the uncomfortableness of like,
get comfortable being uncomfortable.
Exactly.
Feel what it feels like to be uncomfortable.
And it's a matter of time, and it's racing against technology because technology is about fast-paced things, no? And, I mean, we're getting to maybe some ambiguous concepts, but I do bring these concepts to my conversations with parents.
I always said, what if technology is just giving us a gift so that there's a lot of things we don't have to worry about anymore? We can spend more time just being conscious, being more vulnerable. I mean, you can look at it, right? You can choose how you flow with all of it. But I did ask, we asked some of our, we have like a little group that writes in a lot of questions. And there was a couple questions I said, if they could ask you, what would it be? And a couple of people came up with one. They said, if you could redesign a pediatric checkup, like teach it in a pediatrician course, like becoming a pediatrician, what would it look like? How could you, what small changes could we make in a checkup or in the current system of where they're being taught? Do you think that could move the needle?
I think of my you mean residency and how
like if we could teach new pediatricians.
I think about here, the pediatric program I had, it was like tertiary care. It was like a big hospital, like severe, acute, ER, intensive care patients. So maybe I would design more like a program that goes, for example, like as pediatricians, you are supposed to know about the newborn, right? So I would get some field work with midwives, for example. What does it mean to be at a birth outside of the hospital setting? I mean, we medicalized being born as something very technical, So part of the program would be like something more like
midwifery.
Yeah, midwifery. And then I was gonna think something more, a connection with other fields. And nowadays that we evolved as being people standing on our feet, what maybe connections with anthropology, like the evolution of how we are, the way we are, and knowing what happens right after birth. And it's like, as a pediatrician, I mean, more connection with like first is breathing, then is the suck, swallow, breathe. So more, I mean, a requirement, every pediatrician should have certification in breastfeeding, even if it's so like connection courses with IBCLCs. I mean, I don't know. I mean, it's almost 20 years. Dr. Gahary mentions that pediatric residency programs, they only have like lectures about breastfeeding, but you don't get to have like actual work.
Truly understand. The fact that your pediatrician doesn't understand, speaking of that, Vogue did this crazy spread years ago. I don't know, maybe it was like 7-8 years ago. And it was talking about the evolution of breastfeeding, right? And then and one of the biggest movements was that in the 1940s here, I'm assuming Mexico wasn't too different, but when it really changed from men bringing women into the hospital, putting them to sleep to deliver these babies, and then these babies were no initial contact and touch. And then, formula companies becoming very involved in our pharmaceutical situations and then pressing that formula was just as good as breast milk, that this really had a massive impact in where we are as a society today. Dr. Kevin Boyd, I think you know him. You and Kevin need to I need to get you and Kevin on a podcast because, Kevin takes me down these rabbit holes of, he's so passionate right now that he feels as though Alzheimer's, dementia is absolutely connected. We can now help and be able to screen for people that are children that are showing wear and tear signs in breathing that end up with dementia and Alzheimer's. And him and I have my grandfather, who was my mentor, he kind of raised me. I'll never forget. He called me. I was in hygiene. I was just out of hygiene school, and he was living in North Carolina. And he says, "Oh my God, Melissa, the dentist wants to pull my teeth out and charge me $50,000 for these all-on-4s. I'm just going to get dentures." I wasn't in the Airway yet, but I said to him, I go, I really don't think you should. I think you should spend the money. I said, because I know people that are in dentures, the quality of life is so bad. Like, please spend the money. Like, you can't take it with you. And he had this mindset, no, I'm going to be dead and buried of him. Dr. Erick, within 9 years, he never showed signs of dementia or early onset Alzheimer. 9 years. Diet went to heck, never wore the dent. He didn't listen to me. He went to dentures. He took his teeth out. He stopped eating properly. And I'm telling you, he lost 15 years of his life. You can't tell me anything different. The quality, the vertical of the bite changed, his breathing changed, his anger, his central nervous system, all of it because, and no one explained that to him, because I do think if a medical professional would have talked about all of these other aspects, I really do believe that I'm not saying he had no things, but then for me, when I realized my clenching, my grinding, my short-term memory, then me being on Adderall and all these other things saying that I had ADD, I know all of that is connected.
Yes.
There is a huge medical connection to all of this stuff.
Yeah.
That's the part that gets me so frustrated that you can't, any doctor, if I say to them, I go, you tell me if a child is snoring, that's not affecting the frontal, the frontal part of their brain. Oxygen doesn't affect the way they behave.
Yes. I mean, like being more specific, because I do want to answer like your question for like ideal.
Yeah, sorry. Please,
no.
I went all over the place.
No, it's fine.
There.
It's fine. I mean, I just like the ideal, you kept me thinking and you brought up, Dr. Boyd. I mean, the ideal pediatric training program, I think it should integrate what dentistry could teach us. I mean, we have some anecdotes of dentists telling me if I go beyond the teeth, parents do not believe me until a pediatrician tells them so. So I think integration of like dentistry, but functional and biological dentistry, midwifery or midwifery and anthropology and being able to see like how do you have an impact in an adult life. I think we want to specialize so much and then like we don't see the continuum, like be better generalists, but don't forget how we definitely need to honestly collaborate, like it's hard for the human mind to think. I was thinking about saving and now it came to my mind, compound interest. Like people do not understand that you want the immediateness, right? Like the right away. So it's harder for a pediatrician to understand the impact that this could have for the whole life. I mean, like Dr. Hilary Potter says, we're babies that have been compensating for so long, So if we as pediatricians were able, and one pediatric training program, we should have more connection with physiotherapy. And I don't like the word the body work. I don't like.
Yeah. For people that don't know, when you say physiotherapy, you mean just more connective with the tissues, understanding movement, how the bones,
the importance of
fascia
movement, the importance of movement in the expression of an expression of the nervous system of a baby, I mean, maybe going beyond milestones, it's like, for me as a pediatrician, like milestones were like a chart, but I was like completely oblivious of like the progression and evolution and what does it mean from a physical therapy standpoint. I mean, they know so much. I mean, I speak to, or I learn through social media, even like I learn from occupational therapists, physical therapists, chiropractors, osteopaths. I mean, and then the way we evolve, like from the head to toe development, right? And the importance of this part of our body and then how it goes like down to develop. And then these concepts are, I don't know, it was 20 years ago, 2007, but I don't think like residents are being like trained to have these concepts. I don't know if it's age. I don't know if it's the need to care or tend for the hospital care of our population, but it's like being really more preventative pediatric training. I think
fascia. I love that you're bringing up movement because it's so yesterday, you know, I'm on the soccer field yesterday with my kids and a good friend of ours. We're talking about toe walking. And oh my God. And I'm like, we got to work on his feet. We got to get his body moving. And they're like, oh yeah, we've done all the things. It's not working. And I'm like, okay, because you're not either being consistent with it enough, but people don't realize toe walking is a big deal. Like not being able to get those feet flat into the ground. They're like, they're going to grow out of it. No, they're not. They're going to just compensate it. They're going to find another way.
Yeah.
It's going to affect their hips, their shoulders, all their other aspects. What do most pediatricians think about when they see somebody toe walking? Do they even notice it?
I mean, I always I'm always very self-critic because I tell patients, I think I'm a decent pediatrician because I've been well off as a professional. But I mean, everything changed for me over the past 4 years. But if the rest of the pediatricians are the way I see myself back in the day, I mean, they just don't notice. And I think ignorance for us as a pediatrician, I must confess that they always tell you, oh, they're telling a parent they'll grow out of it. It's a way of saying, I don't know, you know? Mm-hmm. But since it's not severe, it's not an appendicitis or a meningitis or something, a fever out of control, you can cover your ignorance. To be honest, I'm comfortable with saying I don't know. But before, it's like you try to like save face with parents and saying, you know what, let's just wait and see, you know, I'll grow out of it. But deep down, it's like, I don't know what the heck is going on with the child. And then sometimes you send them to the pediatric orthopedic specialist. And then I don't know how many of them they do work with an OT, for example, maybe a physical therapist. But yeah, I mean, I think most of the pediatricians will like disregard,
because I actually really appreciate you saying that because growing out of it, I get it. They might not have an answer to it. They're, you know, and it spends time to unravel, but it's like, these are things that you need to notice. Like, it's not if your kid's having this issue or that issue and they start stacking up and on top of it, they can't get their feet. There's something else going on. The body's asking for you to pay more attention to it.
Yes.
The body needs something.
Keeps the score.
So what does it need? Yeah. You know, one thing is I actually, this is just my, I think a lot of toe walking has way more to do with central nervous system stuff than anything else. I think there's always fascia movement, but I know kiddos that we've expanded, they've done some therapy, they've done myo and everything, and then they still stay toe walking. And to me is that they haven't truly done a central nerve, like they haven't reset yet, right? Maybe they're not focusing on their breath or whatever. I always say, I don't mean to be rude on this, but I can say it from a sense. You know, when I knew I had to get real serious about my own issues, when I started to see my son acting just like me. And then I realized that it was my issues that he was I was just passing them down. I didn't do it intentionally. I love my kids more than anything. I mean, and in my mind, I thought I would do anything for them. But I tell everybody, if you look, my daughter, I always say, was a gift from God because I just needed this like unconditional love. So I just thought I was a really good parent. And then I realized she's just like a really special kid. She just does right things. But my son, I say God gave me my son because I needed a mirror. And I realized real quickly that the best gift I could give my kids was working on myself, healing myself, working my own mindset, realizing that I got to this place that I realized when I was yelling at my children, I was yelling the me out of them. Like when I would see my son do something, it was because I didn't want him to do it because it was reminding me of an insecurity of myself. Or I was like, don't do that. Or I would get mad at him. Also with my daughter, now my daughter's 15, I thought she was really great and didn't have issues, but now I'm seeing it on a different side is that I used to tell my daughter not to cry. I used to be like, don't cry, because if she cried, it made me feel bad about I thought I was being a bad parent. It was always about me. And then I was just putting it on them. And I think a lot of these parents, it's hard to have to look inward on themselves, because most of the time what you're feeling inside, yes, something's off, but it also has to do with you, and you have to work on you to help your children. And this is a uncomfortable conversation for providers to have with parents.
Yes.
For a parent, yeah, for a doctor to say, so mom, you're the problem.
I mean, speaking of which, last week I had a conversation with a mom. She's 4 and she's from Europe, and her kid, I think, is a 4-month-old baby, almost 5. Baby cries a lot of digestive issues. She was not able to breastfeed, so she pumps and gives the baby breast milk in a bottle. And I didn't know she's a psychotherapist. But I knew them from the start. Like, the baby was a month and they're like very irritable, crying all the time, colicky with like intense reflux. And I told them, nowadays I'm treating reflux without medications. I do a lot of physical therapy. I send them to this physiotherapist. I tell them, go to craniosacral therapy. That's the way I'm solving things. And just the baby was not getting better. And then the baby had some blood on his stools, and obviously she went to a gastroenterologist, and they told them he had a milk protein allergy, so they recommended a rice-based formula. So long story short, and I've seen how she struggles with her anxiety. She over worries, and she's always like, and I feel the tension in the room. And I speaking of uncomfortableness, like having uncomfortable conversations, I dared to tell her, you know what? I mean, many of the things, because she was saying, I worry. She said the I worry like so many times, like over all the consultations, especially that one, that I dared to tell her, you know what? I feel a lot of anxiety in yourself. Like the way you see, like I told her, like, I mean, I feel tense just being in the room with you. And yeah. I thought I told her respectfully, like what I felt. And I told her, I think it's a big factor of what your baby is showing.
Feeling.
I mean, I think his GI, like a lot of our GI troubles are connected to our emotions, to our nervous system. I mean, Melissa, she was offended. She told me she was in shock. The following morning, she texted me telling me that she was surprised that I dared to tell her that she was a psychotherapist and that it took a professional assessment to make a diagnosis, and I'm air quoting, to the people just listening.
With anxiety.
Yes. And she was offended because, but I dared to tell her that maybe like, and I was mindful like, I'm not saying your kid may not have a diagnosis that the GI specialist told you.
Yeah.
I'm not saying that, but I think that a big factor of your baby's struggles, it's because of you. It's because the way
Absolutely.
You see life. She didn't take it well,
Yeah. And it's interesting. You said, I went to a lot of therapy growing up. I had I get it. All of us, a lot of people have struggles, right? And so talk therapy, I am not denying it can be very helpful. It's needed. I'm so grateful that we have it. It's a tool in the toolbox. But I also know a lot of people that have been in talk therapy for a long time and haven't really figured anything out of themselves.
Yeah.
Like every one of our professions, it's not perfect. It's just, it's a practice and we try to do it. My most difficult patients, and I have the ability, we have a private pay situation. I will not take patients if their parents are therapists, because I find most therapists have a very hard time looking in, they've created another version of their way of dealing with why things happen. And because I believe most therapists want to label that there's something wrong with the brain, and that's why you have this condition. Like it's happening to you, not that you're an active participant contributing to it. And I feel like that's a bit of a victim mentality. I think people like the idea of not taking responsibility of energy or what they put up in the world. And I feel like I can say that, and I say that from a personal person, that if you, okay, we talked about tongue time. A doctor that we were all with had come up to me, and he was not being rude. He was not. I know that he was trying to acknowledge my journey, but in a way he was trying to no, but I could have easily went around saying that I have, mental issues, bipolar. I could have gotten any diagnosis I wanted. I really could have. I don't think I wouldn't have been able to walk into a psychiatrist, and from everything I was feeling, I was trapped in my mind. I was grinding, clenching, fat, gaining weight, losing weight, defensive, argumentative. I felt trapped in my own body. And I was living on antidepressants and all of these, medications, they told me, oh, you have ADD, you have all these things. And when he saw me at tongue time, he couldn't really, he's like, I almost want to say you matured. And I said, I understand you don't know what to say. I said, but I appreciate that you're acknowledging my journey. I said, I have not matured. I said, I go, maybe I have. I said, you know what? I stopped walking around life thinking that something was wrong with me. And I started to take responsibility for my actions and take responsibility for being in control of this life, and that I wasn't a victim. And I said, so maybe maturity is the right word. Maybe a part of becoming more mature as a human, as an evolved human being, is that life isn't happening to me. I'm part of it. And I sometimes need help and I need support. And the best way I got there was getting very, very far away from psychosomatic prescriptions and drugs and being put into a system and evolving myself as a human. And I'm a better parent for it. My kids are better for it. All of these things. And I think that scares a lot of people.
Yeah.
I think it's a big deal for humans.
Yeah, I think we are afraid of like I was listening to you and being comfortable with the unknown, that's uncertainty. I mean, parents and humans, we try to find easy ways to explain things, phenomenon, like many things. I mean, we're too uncomfortable with the unknowns, the uncertainty, and we just freak out. And being a parent, isn't it?
It's scary.
Daunting.
You actually, I talk about it very openly, and I don't mean to, I'm very open, and I say that I chose to go down and do psychedelics. And I was on a podcast with Dr. Alfie. I went and did ayahuasca in a medical setting. And do you know, every single person that I meet, the first thing they say to me is, oh, I'm too scared to do that. That fear of that. And I've realized what that fear and that scare is going deeper into your own brain. They just start to believe that what these closets are in their brain are facts, right? And when you go and you sit with these, and I say for me, I did it with a group of people that have been doing it, Ecuadorian guy, 102 years old, the wisdom that these people have. And the number one thing is that everything is, they ask a question. When was the first time you felt like this? What other areas in your life does this show up? And they use your own fears, your own anxieties to help you break away these layers. And I believe in a lot of cultures and things like this, it really does help them evolve and live these longer, different style lives. And I feel like when Westerners judge it, it's because they're just scared of their own minds. They would rather just be told what's wrong with them or told what's wrong with them than taking an active participant role in this. And I do think Airway, why it's not mainstream, I do hope that one day it will be, is because I don't know if it's mainstream to take responsibility for your own health.
Yes. And it's like Airway and then taking responsibility of your own health. It's not about a magic pill, It's not profitable. Like taking care of yourself. I mean, I'm trying to find a way that you not come to me because you figured it out yourself. And it's scary because it's all about like following the money and being changed to this prison that we created ourselves. We are within it. And to me, it has helped. I mean, the excuse of the Airway has helped me to be constantly mindful or constantly reminding myself that there's a lot of unknowns. There's more out there. It has been like a path, a journey to wisdom that it's unattainable. You know, it's like you're never going to get there, but it's you're seeking that path. You are like connecting and you're never done. You are a work in progress until you leave this beautiful this planet. So
yeah, this planet, the journey is the whole game. That's the whole point of it.
Yeah. You're not getting anywhere.
Right, people will get very upset if I don't talk to you about this.
Okay.
So let's talk. We brought up ADD and ADHD.
Uh-huh.
And that's a very hot topic. I think I'm sure everywhere. And how much does breathing affect the brain? And from your opinion, have something to do with contributing? I don't disagree that people may have ADD or have chemical imbalances. I believe it's all factual. I'm not denying that. But how we breathe, what we do, how we grow, how much do you think that has an impact on how one lives with ADD or how much it affects their daily life? What's your stance on that? When parents come and talk to you about this, what are your thoughts about it?
I think it's a big deal. It's a big deal. I mean, if you consider that it's been hard to identify the answer or solution to this condition. I mean, it's because we're not looking into the right place. So I think, I mean, not to be ambiguous, I think it's our brains are wired in a way that we have to be so conscious about our days and nights, about our breathing, about our sleep, about our decision making. I mean, the way you're not fully rested, you're bound to make bad choices. And your decision making capacity depends, like we underestimate how it depends on a fully rested, like this mystery thing we call sleep, that we pretend to understand it. And sometimes we don't acknowledge it. So to me, the trend of it's also that's easy labeling, you know, like you want to be labeled. You want to get rid of it by like, just give me the diagnosis, you know, like even parents, they come to you and it's like, when you tell them you don't know, let's figure it out. They get frustrated. I mean, I've had moms that tell me, I would rather you tell me, even if it's something bad, but tell me it has a name, you know? So it's complicated, but it's like, I think to get to the point, I think it's overdiagnosed, you know? Because again, it's part of our human nature to have like a knee-jerk reflex, you know, reaction of like labeling things. In the meantime, you know, like let's do some like let's medicate it and pretend it's working. And it's also the law of the least effort, you know, like take the like
I'll tell you, I know lots of kids that are on Adderall or whatever the version of Adderall is nowadays for these kids, and you're just masking.
Yes.
You're not. I lived on Adderall, like, and people are like, no, it doesn't have that effect on people that need it. That's not true. I absolutely have focus issues. And I'm sorry, if you give me any stimulant, I'll be a little more focused than I was. But I also will grind my teeth. I will clench my hiney. I squeeze my tushy all day long. My hips are out of whack. I watched two kiddos, right? We did a little breathing analysis on two kids. One kid that was on his ADD medication. Dr. Erick, he was holding his breath at least 10 times throughout the hour. He'd hold deep breaths in, and then he would go, and then every 15 minutes, he'd go, like he would sigh. He was so dysregulated with his breath, and supposedly he was I guess, paying attention more. He was he was numb. He was just not paying attention. So I had a patient, a Mayo patient, who was he was a pediatrician in Hawaii. He's on Kono, one of the islands, Kono, I think, whatever. And the coolest dude, right? So we start talking. He said he's been a pediatrician on the island for, I don't know, 30 years. And I guess there's some interesting stat that, I mean, it's not a very large population, he said, but he was like, I don't think we have one child on the island that's on that is on ADD medication. He goes, I go, well, why? He goes, I don't know. He goes, I would have a couple parents come in and say, oh, you know, Bobby is acting a little crazy. And I would tell her, well, give him some coffee. Give him a cup of coffee in the morning and put it with some dulce, like, you know, milk it down, have a couple, and maybe up the coffee a little bit. He goes, and then, I don't know, he seemed to be fine. he would focus a little bit more. He goes, I mean, I'm talking good coffee. We grow coffee here, so it's organic. Because it comes from good soil. He said, and I figured at the end of the day, I'd rather the kid have a little bit of good organic coffee every morning than put him on than on a pharmaceutical stimulant. He said, and the caffeine would and if it would wear off, he goes, I tell her, Mom, give him a little bit more lunch and he'd be fine and go play and then he'd go to sleep. I thought, but I thought it kind of makes sense. Why you would rather put your kid on his pharmaceutical than give him a cup of coffee?
Yeah, I mean, to be honest, and I see so many physicians like neurologists and pediatric psychiatrists, and I ask parents, like, how many times? Yeah, we go to the consultation and it just like they modify the dose, they up the dose and the milligrams and that's it. I mean, 30 minutes and it's $100 and you're done. I mean, but do you have a conversation? I mean, and I've had like specialists that like, I do like the pediatrics sleep questionnaire. It's a very basic one. And I ask parents, like, how many times did I ask your kid about sleep at the consultation?
Yeah.
It's like, well, the question was like a general question, like, do they sleep well? But they didn't ask for any respiratory red flags or at all. And it was like, how come? Yeah. I mean, that's the way it is. And I mean, it's the system. It's a problem. You mentioned Hawaii. I do wonder, like, people that are like more small villages that don't have like a good internet connection. They don't have their PlayStations. They don't have their ultra processed foods. I mean, they don't have like this ADHD parents that are, you know, like parents that are like overachievers, all day at the office, and you see them stress out. I mean, kids that for any kind of reason are not breastfed. I mean, I wonder, like, I mean, is it a diagnosis, you know, like the ADHD, yeah, but what's the root cause? I mean, like even mentioning reflux or ADHD or I mean, maybe autism is more like a thing that we need to dive deeper. But these diagnoses of people that are, part of my word, like neurotypical, you know, like, I mean, do they really? You know, what are we really talking about? What are we talking about? Taking the time? Is it like, I mean, but what's causing it? I mean, have you found out? Like, in the meantime, you treated them with medications because the school is demanding that they're like, have to get good grades,
you know? If you don't put your kid, and then so my son, I send him to a private school, and I'm very aware. I send to a private school so I can control the bubble, right? Like, I want the teachers, I do want to be the one that pays their salary. I mean, you know what I mean? That's because I want to control this environment. And this teacher says to me, she started to tiptoe, but she had heard through the grapevine to not bring that word up to me, because even if he's having ADD and ADHD like symptoms, it's never going to be a conversation. I'm never going to put him on medicine. And I said to her, she goes, you know, he's rushing. I said, we get it. My son's very competitive. Everything in his mind at 8 is a win or a loss. Like, I mean, he does this with taking showers or everything, right? And so he wants to win. That's how his mind works right now. Schools are not set up in a way to support that. So I sat with my OT crew and everybody, and I was like, I came up with these cards for my son. I said, well, my son's very smart. He can do things. I go, but we got to make a new game so he can win at this game. We got to make double checking his work or slowing down or whatever a game. So I created these cards. I used breath control, breathe 5 times, all this. I sent her all these cards. I laminated them. Do you know what she came to me? I was so grateful. Her and the other second grade teacher said, can we print this out and put it on all the kids' desks? They all need this. And I said, yeah, of course you can, right? All it was creating a new situation to give the kids something different to do. So instead of trying to fit my son in their box, I just changed the game and created a different conversation. Not saying it's perfect. And the other teacher said, oh my God, I have so many kids that need, of course you do, because all of these kids don't know how to get in their body. You're keeping them so up in their head. Mm-hmm. Like, just breathe 5 times. You know what she came back to me? What do you think she said? Most of these kids don't know how to breathe. Oh, no way. Interesting. What do you mean they don't know how to breathe? Don't know how to breathe through their nose. It's a big deal.
It's a big deal. Yeah, it's wonderful. It's a wonderful thing that it's simple, but it's at the same time, it's a never-ending path to discovery, you know? And
it is.
And yeah, I mean, and
with that, that end of discovery is, I think and again, we could probably talk about it for days. There is no one answer to fix it, right? There's not one thing you and I can if we just kind of go back, bring it full circle. Here we were in Switzerland, a really big conference with really amazing people all across around the world. And it did leave a lot of people a little more confused, unsure where to go, because I left Switzerland not more confused. I felt like that was where we are, but it really did highlight that there is no perfect system. There is no one size fits all for every practice, because let's be honest, Dr. Erick, what you're doing in your hometown, in your city, is exactly what every pioneer needs to do in their hometown. Is you're just not arguing with your other professionals. You're just building something different and creating a place for people to come if they desire a different conversation.
Yeah, sounds about right. Yeah. Yeah.
But that is, you're in Mexico. For a bunch of Americans that are listening or whoever you're in Mexico, you're in a different place. If people say to you, is it easier to do it there in Mexico? I would say probably not. I think it'd be harder. Yeah. I feel like most Hispanics I know are pretty thick-headed, stuck in their ways. And access to medical care. You guys have universal health care in Mexico?
Yes. We do have the social security system, healthcare system. And then, but okay. I do only private practice and people. Yeah. I'm grateful that I do not belong to any health insurance company practice. I don't need to report to anybody. Most of my patients pay out of their pockets. The system is divided or fragmented this way. It's the social security system. We have a lot of people that struggle financially, so they don't have access to healthcare. That's a universal problem. But yeah, the people that come, I have a high fee to my hometown standards. I did a survey of the competition, other professionals in pediatric field, and I have the highest fee, but it's so the people that come to me, they choose to come to me because they know what I'm about, and they're looking for answers, or they're looking for someone that sees things differently. They are fed up with medications. They want to have earlier identification. They are fed up of overdiagnosis of ADHD. They want to have best breastfeeding success. They want to get rid of medications. They want to understand things, and thanks to social media, it's a trend. So it is a trend. Yeah. You're right. It is trending. Yeah. Which is where I wanted to,
as we're going to wrap this up a little bit, was one of the things was I was thinking, like, if every parent listening today or anybody, if we could tell them to send this episode, if we could do one thing to tell them to support their children or to look at different, even I think grandparents also have a big power right now. If a grandparent could tell their child to look into the grandchildren, what would be the one thing you would tell them to look at? What's one little takeaway we could give somebody?
Awareness of nasal breathing. I mean, we are a big metro area, so we have a lot of pollution. So I tell parents, I mean, now taking care of your nose, it is like as if you're brushing your teeth. So awareness of nasal breathing. Movement is medicine. I mean, the way our cities, especially in the US, like everywhere you go, you have to move with a car. Speak of Switzerland and Europe, I mean, people walk more, they take rides on their bikes more. So I think movement is medicine. We are wired to move. I see a lot of kids, we go to the malls, like young parents, they take their babies to the malls. So they have them in their carriers. They don't move them that much. They don't have time because they have to work. So I think we underestimate the importance of movement. And with movement, you have breathing. And with better breathing, I mean, being more mindful, this is like a sleep issues is a public healthcare crisis all over the world. I was listening to the author of the Reckless Sleep.
Oh, Sleep Wreck Kids.
Yep. And she said, like, this should be like governments should be talking about the lack of sleep, you know? And like people, they brag about the United States, like President Trump, telling that he doesn't sleep, and they tell him like it's like a feature. So I think we have to change the conversation about the importance of sleep. We repeat patterns from our caregivers, so they see how you have your stance, your posture, your breathing, like on a car ride to school, and you play. Kids love to learn by play, you know. So
play is a huge one. To be entertained.
That's what I would tell.
And you're right. It's important to have a conversation. I mean, you know, maybe we could get Kennedy to come talk about the power of sleep and breathing.
Yes.
Because we do need more of it. I mean, it matters what you put in your body. It matters how you rest. It matters all of those things, because we are, you know, it goes, we could go back. I mean, there's another conversation. It is true. They make life a lot harder than it has to be. The human experience shouldn't have to be as hard as it is. And I'm not sure we're going to solve that in our lifetime, but man, I sure hope that we are leaving a little bit of the world, or at least our part of the world, a little bit better than we found it.
Yeah.
And I really can't say this enough, and I mean this. It's so exciting to see people like yourself, seeing pediatricians that are willing to step outside their comfort zone, willing to do something that you didn't have to. I always want to state that you didn't have to go do this. I'm sure you were living a fine life, you know, the way you were doing it before. I'm sure your partner and your children probably are like, what is dad doing? You know, there was probably an easier way to do it. But if we don't have people that are willing to be the pioneers, the ones that are willing to build the things and do the things, we don't have growth and we don't have change. So I can't thank you enough for that. I'm so grateful to have you in the community and in the Airway space. You are a breath of fresh air. And if people are not following you and not watching your content, they need to be, because it's important information. We need more pediatricians like you. That's for sure.
Yes.
Is there any last couple things you'd like to leave or let anybody know? Any projects or anything that you're working on, or things for people to keep an eye on?
Yeah, I think I never stop learning. So I think being more mindful of true early identification. I think we have like a lot of C-sections here in Mexico. So I, for example, with the people that help me, I collaborate with, my project right now is identifying early all these challenges of babies and their movement, you know, the reflexes, their head, their neck, the connection with the soft, swallow, breathe. So I think my mission is to be like the the one that helps parents to get this agency of empowering them, even if it's a cliche word again, like helping them like spread the word. So I think that's my mission. Like parents, talk to parents more. And I think it's social media helps me, but then parents here, I think here in Mexico, they have society, parents have conversations with other parents. So they spread the word. So
community, parents listen to parents, people listen to people. I mean, the art of conversation is no joke. It's a powerful tool.
Yes. So, and then my mission, I think my projects will be like creating, just like you're my mentors. You like help me, give me so many examples. I would love to launch a platform. I've had some like messages from physicians, professionals all over the world telling me, when are you going to have a platform to teach? When are you going to have mentoring? People want to come, like a few people here and there have asked me to come and shadow with me to see what I do, and maybe a platform to teach parents, like to get the word out. We need
a pediatrician course.
Yes, something.
We need a course to change that. I'd love to have you work with you need some content. We need it. We need to pull together a room of pediatricians and talk about the things you're seeing different, because like anything, pediatricians only really want, you guys want to hear from yourselves. You want to build that. I mean, that's powerful. I'm ready for that course. Let me know. I'll send a bunch of pediatricians your way.
And keep collaborating with other fields in these movements. So I think keep collaborating, keep learning, and staying humble that this is just a journey. You never end your learning curve. And
that's awesome. Mm-hmm. Well, like I said, I could talk to you for days. We have one way before we wrap up. I always I ask everybody one question when they leave the podcast. What does mind your mouth mean to you? When you think of mind your mouth, what comes to mind?
Mind your mouth. To me, I've said it so many times in our conversation. I love it. The word in English of awareness, it ignites something in me. So be mindful, be aware. And to me, mind your mouth is, I didn't see it the way I'm seeing it now, The mouth, I see it as, I know we are whole-bodied beings, but to me, the mouth and the cranium, the mouth has so many, the delicacy of the mouth. It's even an erogenous, part of our bodies, Mm-hmm. You could have so many things happening from the mouth. It connects you even before having, before having intercourse, you connect through the mouth, Mm-hmm. So I think I'm being more serious about the mouth. And I think it was, to me, a part of our body that was overlooked. That's what I would say.
Yeah, absolutely. The mouth is a very special stuff. Well, Dr. Erick, I can't thank you enough for coming on to the podcast today. We're going to put all in the show notes where to find you, follow you. We can't wait to see more from you, and I can't wait to have you back on. For everybody, thank you again so much. This is another episode of Mind Your Mouth.